This is the JTV Caribbean News. I am Sean Rose. The Trinidad-based Caribbean Public Health Agency CARPHA is warning the Caribbean not to be complacent as it deals with the outbreak of the chikungunya virus and the preparations for the deadly Ebola virus. CARPHA Executive Director Dr. James Hospitales said that the number of reported cases of chikungunya continues to increase and provides a challenge to public health services. Dr. Hospitales said they expect the number of chikungunya cases to increase because people in the Caribbean are encountering this virus for the first time and do not have any immunity. But the CARPHA official said Caribbean countries could do a lot to minimize the spread of the virus through the concerted efforts of individuals and families, communities and neighborhoods, adding that it is everyone's responsibility to avoid mosquito bites and prevent mosquitoes from breeding. Dr. Hospitales said, with U.S. CDC reporting the first imported case of Ebola, preparation for the possibility of the Ebola virus reaching the Caribbean is also of paramount importance. And the Pan American Health Organization, PAHO, says ministers of health from throughout the Americas, including the Caribbean, have endorsed a series of actions to fight childhood obesity, which has reached epidemic proportions in the Western Hemisphere. PAHO says recent data shows that 20 to 25% of children under age 19 in the region are overweight or obese. According to PAHO, key drivers of the epidemic are excessive consumption of high-calorie, low-nutrient processed foods, especially so-called junk food and fast foods, along with consumption of sugar-sweetened beverages and low levels of physical activity. Dr. Chesa Luta, PAHO Regional Advisor on Food and Nutrition, said environments have to be changed to make the healthy choice the easier choice for children and parents alike. An adopted 5-year plan sets out 4 main lines of action to help countries reduce rates of child obesity. They are breastfeeding promotion, better food and more physical activity in schools, junk food taxes and restrictions on marketing, and increased access to recreational spaces and nutritious foods. Bermuda's Finance Minister Bob Richards has defended plans to forge ahead with cost-cutting reforms of the civil service, saying that unless action is taken, the government will soon be broke. At a packed public meeting in Hamilton, Richards insisted that in order to get people back to work, government need to reduce expenditure, cut its deficit, and attract more foreign investment. These recommendations put forward by the Independent Spending and Government Efficiency SAGE Commission were met by a sometimes hostile audience. Mr. Richards pointed out that since 2008, government expenditure had exceeded revenue, with salaries and debt service accounting for nearly 60% of government expenditure. He said the present state of Bermuda's government finances is totally unsustainable, and there is an urgent need to grow the economy to increase government revenue and also to constrain and reduce government spending. The finance minister's presentation was often shouted down by audience members during his presentation, while protesters gathered outside the hall carrying placards and chanting "Save our jobs." The Bermuda government's 16 high-level policy decisions include the modification of the leadership structure of the civil service, reforming human resource policy, strengthening budgetary planning, and perhaps most controversially, setting up an efficiency and reform authority to evaluate privatization and outsourcing of some civil service departments and jobs. The Republic of China on Taiwan is continuing to assist the government of St. Lucia in its ongoing fight to combat the black sigatoka disease. St. Lucia received $500,000 to assist banana and plantain farmers and bolster production figures recently. Alison Kentish of HTS News Force reports.
Black sigatoka is considered one of the most dangerous diseases affecting banana and plantain production in the Caribbean. Locally, the Ministry of Agriculture has embarked on a comprehensive program to tackle the plant disease and increase production. Taiwanese funds have been critical in ensuring that the program is successful. On Friday, October 3rd, Ambassador James Chang presented a check of $500,000 to the Agriculture Minister, the third set of funds toward the effort to tackle the disease. $300,000 is earmarked for disease treatment and prevention, and $200,000 for diversification of crops and field drainage. Ambassador Chang says he is pleased with the success taking place in the fight against the disease.
It is nice to mention that there were a 6% growth in the export of bananas to the international market in the year of 2013. In conclusion, it is my firm belief that through our joint efforts, the capability and the confidence of the banana farmers will be greatly enhanced, and the high-quality produce will for sure bring tremendous business and marketing rewards to all of the farmers in St. Lucia.
The Agriculture Minister expressed his appreciation for the donation and says the island's banana and plantain farmers stand to benefit significantly from the generosity of the Taiwanese government.
The project continues to be on course, notwithstanding some setbacks caused by the adverse and extreme weather conditions. We had the December trough, and in 2014, an extreme weather event, this long and sustained drought. As a direct consequence of the impact of the December 2013 weather event, most people call it the trough, the project found it necessary to re-examine some of the core elements of the technical work plan and the need to reschedule some of the project activities.
The Agriculture Minister expressed his appreciation for the donation and says the island's banana and plantain farmers stand to benefit significantly from the generosity of the Taiwanese government. The minister says undoubtedly banana farmers are facing many challenges and the industry still has many hurdles to overcome. But he says he is satisfied with the structured program which is in place to tackle the plant disease. He says through this collaboration with the Taiwanese, farmers will have the opportunity to improve their quality and output. Alison Kentish, HDS News Force.
And finally, in this week's regional news segment, the United Nations Human Rights Office says it is essential that legal proceedings and investigations against individuals associated with former Haitian President Jean-Claude Baby Doc Duvalier continue despite his death. A spokesperson for the Office of the UN High Commissioner for Human Rights said while all the crimes were obviously not committed by Duvalier himself, it is imperative that the perpetrators of all abuses be brought to trial. The Office of the UN High Commissioner for Human Rights noted serious human rights violations, including torture, rape, and extrajudicial killings dating to the period spanning 1971 to 1986, the years when Duvalier was in power, and have been extensively documented by Haitian and international human rights groups. Earlier this year, Haiti's Court of Appeals reversed a January 2012 decision that stated that the 63-year-old leader could not be charged with crimes against humanity, which occurred during his reign, because the statute of limitations had expired. After 25 years of living in exile, Duvalier's return to Haiti in 2011 spurred victims and civil society organizations to seek justice for the abuses committed during his 15 years in office. That's it for the JTV Caribbean News. Sean Rose.
And coming up next on JTV News. A new telestroke service at Peebles Hospital gives stroke victims in the BVI remote access to specialist doctors. MASA launches Medical Air Ambulance Emergency Service in Virgin Gorda. An acting principal of Virgin Islands School of Technical Studies, Jermaine Scatliff, talks to JTV News about the new secondary school.